Good morning, Peter Goertz. I'm a psychiatrist. I often get called, or a large part of what I do is consultations, psychiatric consultations for patients in emergency rooms and on medical wards. And I often get called to see patients who are confused. And what's really important, I've found, is to very early in the interview ask patients basic questions regarding orientation. Do you know what day it is? What is the month, etc.? Because otherwise what's happened to me is I've gotten, let's say, 10 minutes or longer into the interview, the patient's able to talk, how are you, nice day today, but then you realize they don't even know, where they are or what month it is, etc. And their information that they gave is not reliable. So that's an important thing to start with, the basic orientation questions. And if someone's confused, you want to rule out medical issues. That's the first thing really to try and rule out, like a stroke, seizure, thiamine deficiency, so Wernicke's encephalopathy. And often medications we give as doctors can cause confusion, not just psychotropic medication, but general medical medications can also cause confusion. I saw a patient yesterday who came to the hospital with hypoxia, so not enough oxygen in her blood, but also she was found to have a high BUN, high creatinine. So her kidney function, the BUN was 55, about creatinine 7 maybe. So way higher than her baseline BUN and creatinine. So her kidney function was way off also. So those things, the oxygen, the low oxygen, and the impaired kidney function may well have contributed to this patient's confusion. Plus, she had a significant psychiatric history, so it was kind of hard to tease out. And when we prescribe medications, of course, we want to strike a balance between therapeutic and adverse effects. And any medication can have adverse effects. A patient I saw last week after a suicide attempt via benzodiazepine overdose her situation was food for thought for me. She was drowsy somewhat after the overdose, and benzodiazepine overdose, of course, can cause sleep, drowsiness, confusion. But I also realized with that lady, she'd been taking prescribed Xanax, it could have been any prescribed benzodiazepine regularly. And if someone overdoses, they may be sedated, confused from that, but also if we abruptly stop a benzodiazepine, so let's say she's becoming less sedated after the acute overdose, at some point we need to probably restart the benzodiazepine, in this case the Xanax, so that she doesn't go into Xanax withdrawal and have a seizure or get confused from a Xanax withdrawal. So it's tricky, and I think that's part of what's fun about medicine is things are not cut and dried. There's a lot of room for creative thinking and trying to tease out what's actually going on with the patient, kind of like a little bit of a detective story. If someone's confused, it can be from low sodium, and SSRIs can cause low sodium. Carbamazepine can cause low sodium in the blood. Oxcarbazepine, trileptal can also cause low sodium. So that's another thing to think of if you get a patient on an SSRI who becomes confused. It could be from low sodium. Lithium can cause problems. You want to make sure the level of the lithium is not high. And if someone's on a stable lithium dose with a stable level over time, and all of a sudden becomes confused, what can have happened is they, for instance, can have started taking a non-steroidal anti-inflammatory medication, which can markedly increase lithium levels. They might have started taking a thiazide, which can also markedly elevate lithium levels. So you want to really, especially with lithium, I ask all of my patients whom I start lithium on, please call me if you want to start taking any new medicine, please call me before you start taking it. Because NSAIDs and thiazides can really markedly, for example, increase lithium level. Other drugs, quite a few other drugs can also increase lithium, the level of lithium. Now, another tricky thing is if someone's on lithium and starts becoming confused, you want to also probably check their thyroid function, so a TSH, because lithium can cause hypothyroidism. And that can cause confusion also. Drug interactions themselves between each other, between drugs, can cause problems. I once had a patient who had been on Prozac, and I think Wellbutrin was added, and then the dose of Prozac was increased. I may have been the one who increased it, I'm not sure. But he had a seizure. Young gentleman, no history of seizures, and Wellbutrin can cause seizures, but from what I understand, the Prozac, by inhibiting the enzyme P452D6, can increase levels of Wellbutrin, which makes the seizure then more likely. So we want to be careful with the combination of Prozac and Wellbutrin because the Prozac may increase the Wellbutrin level, and Wellbutrin in itself already has a risk of causing seizures. And especially then if you increase the level of Wellbutrin, that may make a seizure a lot more likely. A lot of medicines we prescribe are anticholinergic and can cause confusion. Thorazine is quite a very old antipsychotic which was synthesized originally in the 50s, can cause confusion. It's very anticholinergic. Hydroxyzine is anticholinergic, can cause confusion. Benadryl also, Cogentin. And this past week I saw an older lady in her late 60s who was on Thorazine and had been confused. So especially in older patients, we want to be very careful with anticholinergic medications. When someone's on Depakote or valproic acid and gets confused, you want to check an ammonia level, serum ammonia level, because Depakote can cause elevation of the serum ammonia level, which can cause confusion. So a lot of different things to think about when a patient's confused. And again, that's part of the fun of being a doctor, I think, to try and tease things out and be creative. But sometimes if a patient is confused, it's our fault as doctors because of the medicines we give. Thank you.